Happy 2025, everybody. January 21st. I am Dondre Simpson, class of 99, So Divine, president of HUCDAA, formerly known as the Howard University College of Dentistry Alumni Association. We're starting a new thing here, and we're getting ready to start showcasing our alumni. The one thing we've always done as HUCDAA, the Alumni Association, is focus on the dental school, which is our beloved, for the reason that we are who we are, especially for our profession. We're starting to refocus a little bit. Blame me, because I'm a little slow in country, but the heart is always in the right place. We're going to start focusing more on alumni. Duh. So our focus still is to support the dental school. The dental school should be also and is getting better at fundraising and things like that, which we're still going to continue to help with. But right now, we're going to start focusing more on alumni. What better way to start off our first inaugural showcase by interviewing one of my little sisters? And I have to say, I ain't gonna get too personal here but we both had the same mentor, so I feel that she's like a little sister to me. Dr. Hazel Harper was our mentor. We worked in her office when we was in school. I was a little bit older than her. I graduated in 99. She graduated in 2007, but I'm so proud of her. I'm gonna try to keep it professional. Okay?
Thank you, Dondre.
But you know me, I'm Dondre, and you Chanelle, but more known better as Dr. Chanelle Small, class of 2007. Received her certificate of endodontics from School of Dental Medicine, and obviously her DDS from Howard, and her undergrad from Howard. She's a former instructor at Columbia University College of Dental Medicine, as well as having extensive experience in private practice for over 15 years. Dr. Small is the founder of Midtown Endodontics, a specialty practice located in New York City. She has lectured for over 10 years to general dentists and GPR residents. She currently donates pro bono services to those in financial need through various charitable nonprofit organizations in the New York City area. Additionally, she has participated in a volunteer mission trip to Haiti to provide critical dental care to the underserved. She is a believer in mentorship and welcomes students and new dentists to her office to shadow her and gain insight into dentistry and practice management. Outside of the office, Dr. Small is a wife, a mother, and another mother as of a couple of months ago to a bouncing baby boy who has a big sister, as well as a real estate investor, expert witness, and marathon finisher. So I want everybody to give my little sister, Dr. Chanelle Small, a big welcome.
Thank you.
Thank you. Blessings to her. Welcome, Chanelle. Dr. Small. But, if I call you Chanelle, y'all just have to know it's a little personal, but y'all know she Dr. Small to all of us. So welcome, Dr. Small.
Thank you so much for the invitation, Dr. Simpson, Dondre, and Kemi. Thank you so much. Happy to be here.
Awesome. Well, we're going to we're keeping this really informal, even though you look very formal right now, but we're going to keep this informal because all of the information, and we know you, as phenomenal as you are, is going to be so formal. So I'm just going to ask you a few questions and you just give me your heart. You know what I mean? And that's really what it's all about. So just give me a couple of seconds here and we're just going to get this thing started. What inspired you to pursue a career in dentistry and how has that vision evolved over the years?
I always liked science. I knew I wanted to be in healthcare, but I never wanted to be a physician. I never wanted to deal with telling someone their mother just died, their father just died. I never wanted to deal with that. Also, there's so much uncertainty in medicine. You could have a headache and you could be dead the next day. So with medicine, there's a lot we know, but a lot we don't know. We're not God. So I feel like in dentistry, I have a much better command over things. I went into undergrad still pre-med because as a biology major, everyone was pre-med. So I just said I was pre-med. But freshman, sophomore year, I stumbled upon dentistry and I've been in love with it ever since.
Awesome.
So how has that evolved over time? Initially, like most of us, we're in dental school and we're just bogged down with class 2s, class 3s, fixed, pros, everything. And you're only focused on the clinical. But as you graduate, you see that there is more to dentistry other than clinical dentistry. So I've also been on faculty at two institutions. One's a hospital, one is a school. So same teaching, but different experiences between Columbia and inner city Brooklyn Medical Center. So I had that experience in teaching. Also now I have been working as an expert witness where it is a very interesting intersection between the legal field and the dental field. And I work with attorneys to help them establish standards of care in malpractice cases. We can talk a little bit more about that later, but it's very interesting.
Very awesome, because I feel that so many different areas of, like, whether it's legal, whether it's institutional, state government, whatever, don't have enough of us dentists as knowledge point. There are a lot of people make rules and do laws and stuff without sometimes even consulting with a dentist. So to know that you're legally, involved with cases like that is actually good, obviously, to figure out a certain situation, but it's also education.
Yes.
Those attorneys are learning about what dentistry is about. Those, hopefully, plaintiffs and defendants, or whatever they're doing, to hopefully get a better standard of care, regardless of whose fault it was or what happened to what. Even though you didn't want to be a physician and deal with people dying, you as an endodontist deal with a lot of infection. And I know for a fact a lot of what you do does save lives and keep certain infections from spreading even further than beyond the dentition. So yeah, you got away from being a physician, but you still are saving lives in a lot of ways, especially as an endodontist. Can you share a pivotal moment in your career that shaped who you are today?
Yes, I would say the opportunity to buy a practice. So initially, when I was at Howard, I was focused on my clinical requirements. I didn't even think about starting my own practice or owning my own practice. And when I first started, I did not have the confidence to work for myself or work by myself. And it takes time to develop the confidence as time goes on. And owning your own business is not for everyone. But the answer to your question was a pivotal moment when Dr. Karen Gear, she's a Howard alum, I reached out to her. It was New Year's, and you send those group New Year's texts to everybody on your friends list. And she said, "Oh, let's get together for lunch or dinner." And I said, "Sure, no problem." So we got together, and she said, "I'm moving and I want you to buy my practice." And I was like, huh? So it was pivotal because it really shaped the next 15 years, or no, it's been 13 years, shaped the trajectory of my career as an endodontist and a clinician. So just the opportunity to buy my own practice in New York City, nonetheless.
Awesome. I mean, that's definitely always good to have people that you are networking with, obviously mentors, as you and I have had mentors and share mentors. Sometimes you be in the right place at the right time, or met the right person at the right time. It sounds like Dr. Gear definitely was very pivotal there. What challenges did you face early in your career, and how did you overcome them?
I would say my biggest challenge when starting off was that I did not know intimately the business of dentistry. So I had to make it my business to learn my business. And what I mean by that is we learned the clinical skills. You learn that in residency, in dental school, working, but owning your own practice is a whole different skill set, and interacting as an employer and employee and being a leader. I was in student government and those kind of organizations, but we were all students. So student organizations, church organizations, you're all in the equal playing field. But when you are owning the business, you're the employer. So it's a different dynamic there. I had to learn about the mindset of being an entrepreneur. And just because you own your own business, it's different to be a high-level entrepreneur, which is what I strive to be. So books, podcasts, conferences, reading, I had to devour all that to learn how to run a business and run it well and grow and all that kind of stuff. Because you have to learn the clinical skills in school. And I know a lot of times students may complain, we don't learn how to run a practice, or we don't learn that kind of business stuff in school. But I feel like in school, you have to learn the clinical dentistry. I don't know that there's enough time in the 4 years of dental school even to learn everything about clinical dentistry, let alone the business. So it was a challenge, but I had to make it my business to learn how to run a business and overcome that.
This is like a little sub question to this. Before you opened up your own practice, did you ever work as an associate or work in a corporate situation? And if so, what was your thoughts on that?
I worked as an associate in almost every borough in New York City. Okay, I was working 6 days a week. I was tired. I was working. So yes, I was an associate. When I was in residency, I worked moonlighting. So one night a week, I would work doing root canals at general dentist's office. And then when I came out of dental school, I worked in a group practice, mainly 4 days a week. And then the other 1 to 2 days a week, I was at different offices as a traveling endodontist, bouncing around. When I was in residency, I worked in corporate dentistry dentistry in Boston for like a semester. It wasn't a long term, but I did work a short time in corporate dentistry, mostly private practice since I graduated.
Awesome, awesome. I think it's good to always have a well-rounded. I personally am in private practice. I'm in prisons, jails.
You used to work at the prison, yeah, I remember that.
Military, I've done that. Not in the military, but working on the military and being honored to. So having a well-rounded view brings it back to, with me, and I'm assuming it's for you now that you have your own practice, kind of gives you a more, being more well-rounded so you can bring more to your private practice and still be able to, like you do, pro bono work in the community and travel on mission trips and stuff. So I just think that's very important to get various offices and work in that early in your career like you did and like I did too. So how do you balance the demands of dentistry with your personal life?
You have to try to do the best you can. So for me, one thing I do, I try to leave work at work, because as a business owner, you're always thinking about it. It's always on your mind. So the last thing I want to do is kind of physically do work, meaning some people log in and they write up their charts at home. I don't. I don't want to. When I leave, I'd rather spend an extra 30 minutes here or 45 minutes here and write up everything, get everything out. So I know that once I leave, it's done and I don't have to log in and do anything when I'm at home. I can focus on my husband, focus on my children, focus on myself. I'm still working it out. It's a work in progress. But one thing is that I try to leave work at work as much as I can, get everything done before I leave here, because once I get home, I want to be able to focus on home.
It's hard.
It's a work in progress.
Especially when you have your own business. You know what I mean? If we worked at as an associate or worked for corporate, it's much or institutional dental care. It's easier to leave work at work. But when you have your own business, it's almost like you have another baby or another spouse, literally, that you got to take care of. So kudos to you if you can go home and not have to do any work. I mean, that is.
You're thinking about it. You're still thinking about it. But I've also been here. I've owned my practice been 13 years. So for me, it would have been almost impossible. I know what it takes to grow a practice. It would have been impossible to do this with small children. For me, I wouldn't have had the bandwidth.
What advice would you give to new graduates entering the dental profession? I know you mentor, so what advice you give them when they're getting into this profession?
I would say think about the long term, think about where you want to be long term. A lot of people want to come to New York City and go to big cities, which is great, and that's fantastic in your 20s when you're young. But think about your long-term plan and where you want to end up, I would say. It's one thing. Think about your spouse. If you want to get married, really take a lot of time and consideration into that aspect of things, because your spouse is going to be your partner in life. So you mentioned about balancing work and home. If I'm here, obviously I'm not at home. So you need to have a partner that is on board with everything you're doing also, as far as running a business, knowing you're not going to just punch out a clock at 5 o'clock. So you're going to be thinking about work, you're going to be doing extra work. So you have to make sure, put a lot of time and consideration into your life partner. And I would also say to surround yourself with people who have your best interests at heart, and also people that are where you want to be. Your classmates are fun, but you guys are the blind leading the blind. So don't ask your classmates questions because they don't know anything, or someone that's 1 year ahead of you. Look for someone that's 5 years ahead of you, 10 years ahead of you, 20, because also your thought process will change between 5 years out of school and 10 years out of school and then 20 years out of school. So try to surround yourself with people who are where you want to be, and people that will tell you like it is, and people that have your best interest.
Totally agree. I can't argue none of that. How has mentorship, either as a mentee or a mentor, impacted your career?
I would not be where I was today without mentors. The end. So for me, I've had mentors that have helped me with the hard skills and the soft skills. So I'll mention Albert Granger. He's a Howard graduate, and he's helped me with the hard skills. When I graduated from endo, I worked for Dr. Granger. So it was a large group practice in the suburban Nassau County, suburban New York City. He taught me everything I didn't learn in residency. So the clinical skills, just super dentist. I learned the hard skills from Dr. Granger. The soft skills I learned from Dr. Harper. She's the mentor. Everything you talked about with networking, putting yourself in the right rooms, speaking up for yourself, advocating for yourself, making sure you know if you're not at the table, you're on the menu. How are we working our way into these spaces? Dr. Harper embodies all of that from start to finish. So she was my first dental employer. My first dental job was at Dr. Harper after undergrad, and she's been a mentor ever since.
She's awesome. Dr. Granger is like so phenomenal too. He's so cool. I've met him a few times, and he's definitely also
good person and good dentist. Yeah,
just good people for real. Now, How have you maintained relationships with your classmates or other alumni over the years?
Well, we still have our group me chat. That's probably 15 years old. So this is our longest running group me chat. So we still have our group chat. Nowadays, everyone has social media. Everyone is Facebook, Instagram, whatever. So you keep in touch with most people in our group chat on social media. And the people that you text and you talk to, you still have your core group of friends that you text and talk to on a regular basis. I love running into my classmates at the NDA conferences and the ADA conferences. That's a nice time to, and the Hinman, that's also a good one in Atlanta every year. So that's where I bump into classmates in person, but we all maintain contact virtually.
So being that you're a Howard alum, I know you've been at Tufts, I know you've done some work at Columbia. In what other ways do alumni support, or can you see that alumni support each other or can support each other, even though, because this is a Howard thing, of course, but you know, I know you've been blessed to be in other schools and other situations. Can you share, if anything, you know, what other ways that you've seen alumni at other schools be supported that we may can take experience from or whatever?
I think with Howard, we are hitting all of the marks. We are doing everything that everyone else is doing. And I don't think we should think that the majority institutions are doing something enlightening that we aren't. So every year they may be more consistent with it, but we're doing what we need to be doing, maybe just to be a little more consistent. So for example, every year at the Greater New York, the Tufts Alumni Association has a big, huge dinner every year. At every ADA conference, usually the Endo conferences, the Tufts alumni has, and Columbia alumni has their reception at every conference. So Howard, we have it at some conferences, but not every conference. So that may be one thing that we can improve upon. But we still do have our networking. We're running pretty strong. Let's not discount what we do.
Just always good to know, because, you know, like I said, we always look striving to be better and we don't want to reinvent the wheel all the time. So,
yeah,
you know, knowing what other schools do, being blessed that you've been not only a Howard alum, but your other alum too, definitely makes everybody better. So kudos to that. And the next question is about networking, which you kind of, you know, said the NDA, ADA, Hinman, any other networking?
Your specialty conference. Yeah, your specialty conference, if you are in that. And that's where I first met Karen Gear at an endo conference in Orlando, Florida, when I was a resident. Kind of bumped into and then reconnected rather when I moved back to New York. So wherever you are, you know, I always try to look for someone that looks like me wherever I am. Cool. So don't think, you know, it has to be limited to the NDA. No, wherever you are, look for someone that looks like you. I try to do that.
If you can go back to HU, dental school, of course, not undergrad, what would you do differently?
Good question. I think I would have taken advantage more of other aspects of dentistry, specifically surgery, because I was always afraid of surgery. And not to say I shied away from it, but school is the environment to jump into the things that you are afraid of because you have someone there to hold your hand. You have multiple people there to hold your hand. So if I were to go back, I would have not been as safe. I wouldn't have been aggressive, but I would have leaned a little more to the aggressive side as far as clinical procedures that I wanted to take on and maybe tackle more difficult cases. But I did not have the confidence. So on the other hand, you know, I didn't want to handle something or jump into something that was over my head, but I didn't recognize that school was the time to do that.
Right. And speaking of surgery, as you know, our surgery department, awesome, but very intimidating. So a lot of the men and women there, especially, and I'm not going to put, well, I will put her on blast because she was like so awesome. I was so scared of Dr. Mygill, you know, Dr. Karen Mygill. And
she wasn't there when I was there. I don't know her.
Well, she was awesome because, but she had a reputation that she lit into your behind. I ain't going to say the word I really want to use. But when I saw her, yeah, I was sweating bullets. But and I remember one question she asked me, hey, what is acute osteoalveolitis? And I'm like, I say, Dr. McGill, I do not know that, but by the end of the day, I will definitely find that out for you. And that was one of my pivotal points in surgery. She said, well, you ain't supposed to know it because I ain't taught it to you yet. And because you said it like that, here, I'm going to teach you how to elevate this tooth, And I'm like, you know, I thought you were going to light in my butt. And from there on, Dr. Maggie was like one of my favorite surgery professors when everybody else was like running from her. You know what I mean? So it's all about relationships and just being true to who you are. And I told her I didn't know it, but I told her I'll find out by the end of the day. And then knowing that I wasn't taught that. I was going to figure it out, but she had already said, you ain't got to find it out because I'm going to teach you later next week in lecture. So it was real cool. Sorry, this ain't about me, but you're right.
It's all good.
getting more involved in things that you are afraid of actually makes you better. So
Yes,
you're
yes.
right. And surgery was one of them for me too. How have you used your skills to give back to the community? I know you've done a lot there locally as well as internationally. Obviously, you do root canals, but
Yes.
when you're giving back, kind of explain what's that like for you when you're doing that?
Right.
Because I know a root canal technically is a root canal, but is it more special when
Well,
you're giving it?
no, no, no. Well, one thing I would say, which is kind of a different answer to your question, is use what you have. Just use what you can. You can't pretend to be something else. So yes, I'm an endodontist. So in a rural setting like rural Haiti, I'm not doing root canals, but do what you can. And
Mm,
here, when I was in Haiti, I was given anesthesia. I was getting them numb because I can get them numb. I can't elevate a wisdom tooth. Don't ask me. That's not my ministry or my lane, but I can get the patients numb and line them up for those who can, for the surgeons. So do what you can in your own way. So here, even for example, my sorority, Alpha Kappa Alpha Sorority Incorporated, had a program a few years ago called Ascend for high school students. And there was a young lady that was in the program. She was interested in dentistry. She reached out to the person in charge of the program to get my information. She asked if she can come
mm,
to my office. So she came to my office. Very young, very pleasant, just such a nice, pleasant young lady. And she reached out to me maybe 4 weeks ago because she was out of school for a semester, whatever happened. Do you know anyone that's looking for an assistant or receptionist for a
okay.
semester? So I was able to put her in contact. I don't need anyone, but I was able to put her in contact with someone else who is looking for an assistant. So because I'm an endodontist, I don't feel like I have to be looking for every root canal out there. I do what I can do and fit in and do what I can when I can to help someone. I help people that need help.
Awesome. How did you approach finding your first job or residency after graduation?
So Dr. Harper, Hazel Harper, said, you need to contact Dennis Mitchell Lewis. He's in New York.
Oh, wow.
And
Yeah.
then Dennis Mitchell Lewis said, you need to contact Albert Granger. He's in Long Island. And that was that. And Dr. Granger, when we first talked, he thought I was getting ready to graduate from Endo, but I was getting ready to graduate from Howard. So he thought I was 2 years ahead. He was like, oh, I need somebody now. So I'm like, hold that thought, because I'm only graduating from Howard now, but hold that thought. So we first made contact again through Dr. Harper, who put me in contact with Dr. Mitchell Lewis.
Dr. Mitchell Lewis, yep.
Who I saw just recently at the NDA conference in Las Vegas a couple months ago. And then Dr. Granger was his buddy. They were not classmates, but I think they were a year or two apart, and they were good buddies. And then Dr. Granger put us in contact, and we've all been rolling tight ever since. And these are contacts and connections going back like 20 years.
For life. It's lifelong. I mean, it's just awesome. For those who started their own practice, what was the biggest lesson that you learned early on when you started your practice?
I can say a couple. Initially, I thought all you have to do is be nice to your patients and do good root canals and you will be successful. And that will make you a good endodontist and a good clinician, but it's a lot more involved in running a business, and you are running a business. Further along in my career, I do think it boils down to that, still being a good person, being good to your patients, and doing good clinical dentistry. What was the question? The biggest lesson I learned? I would say your mindset is very important. Your mindset, your skill set, and your network. Those are the three things you need to work on. Your mindset, your skill set, and your network. So your mindset as a business owner, as an entrepreneur, as a forward thinker, you need to work on that if it's not already there. Books, podcasts, lectures, that type of thing. Your skill set. So you always need to be doing continuing education, seeing what's going on, what's new, reading your journal. We have the JOE, Journal of Endodontics, reading your journal, doing workshops. So that's your skill set. And then your network, which is everything else we talked about earlier.
Right. But again, starting your own practice, they don't teach you how to deal with employees and staffing issues and HR and stuff like that or whatever.
Right.
Definitely can relate to that.
I've always prided myself in having long-term staff and team members. So all of my team members have been with me 5 years, 6 years, 7 years. Now I have a new staff because people have moved on. No one has thankfully ever left me on bad terms. They've left to go back to school. Well, one of my receptionists left during COVID and she had to do homeschooling. Another one, my previous office manager, her mom was ill. She moved out of state. Or a couple of my staff members went back to school. But I encourage that if you're moving on to bigger and better. People have moved on to bigger and better things, but no one's left on bad terms. So I pride myself in having staff members for 5+ years. everyone's been with me 5+ years. So I can see the issues there. And yes, there are their own issues, but if you treat people well, don't be cheap. Don't, have someone leave over 50 cents or over something that is so silly. Don't chase pennies and you're skipping over the dollars. And your team members are dollars.
I agree. How have advances in technology influenced your approach to dentistry since you graduated? I know you use probably a lot of technical advanced stuff in your office.
So when I was at Howard, we were still developing in the box, in the dark room or the shadow box. So I was on the transition between old school and new school, between paper, film, and digital, paper copies of records, transitioning to digital. So I'm familiar with the old school, but definitely embracing the new. So since graduating, everything is now digitized. In residency, we used microscopes, but we did not use 3D cone beam. So cone beams were getting popular, not as mainstream as they are now, but the 3D imaging with the cone beam is probably the biggest advance in endo. But for me, the biggest advance is everything, like you, everything being now digital.
Gotcha. Totally get it. What impact has social media or digital marketing had on your career practice?
I have not utilized social media to its maximum. I am starting to, I want to, I embrace it, but social media has the ability to, blow you up from a nobody to someone that has, 100,000 followers and, blow up overnight. So to answer your questions, I have not utilized it to its maximum, but I'm wanting to utilize, especially Instagram as a platform. So I've started posting some educational videos. I have a couple more in the pipeline, just sharing endo tips, tricks. If you DM me anything, I'm happy to make a video about it. So I think it has the opportunity for you, one, to reach many. I'm one person and I can talk to you one-on-one, but with social media, you can reach millions of people with the click of a mouse with your phone that's in your hands at all time.
And what I found is, even with my practice, I like to educate. I'm an educator also, in a dental school here in South Carolina, but also I like to educate just people. Yeah, I mean, MUSC. But the thing is that the education piece for me, inadvertently have brought me patients, the thing that I've done on social media, both on my website and things like that or whatever, not trying to get patients, but when they see that you're giving them free information, free knowledge, free advice, which I do anyway, you know what I'm saying? It's not about getting paid. And then it just helps. So yeah, and I've seen some of your stuff online lately, and I just think it's awesome. So continue it. And I would advise you to, because you're at that point now where you know what you know, and what you don't know, you might want to know if you want. If you don't, you don't. And you 15 years out, you were seasoned. So people will want to hear from you, not only just potential patients, but also, like you say, upcoming students, or whatever. So, so yeah, again, you're just definitely doing the dang thing. How did you navigate the unique challenges posed by COVID? I know y'all was hit very hard in New York, as we all have been.
Yes. So there were very strict mandates in New York State during COVID. So for quite some time, dentistry was limited to emergency treatment only. So nothing cosmetic, emergency only. So pain, infection. For endo, that encompasses what we do, pain and infection. So a lot of my referring doctors, some close right away, some close a couple weeks after. I closed my practice really for about 3 weeks, probably. I want to say in May, about 3 weeks. And part of the reason why is because we talked about being an employer. I drove to work every day, but I'm in New York City. So in a major metropolitan area, people take public transportation. One thing is I did feel bad that my team members are taking the train, and on the train, the subways, they're packed, no social distancing on a train. Everybody's packed, shoulder to shoulder. So I did feel bad that they were on the train exposing themselves, and I was comfortable driving in my car. So I did feel bad about that. And I navigated it also by maintaining our network and contacts. And I think the ADA, they had a lot of information coming out. Everyone had group chats coming out, and there were Facebook pages coming out, just sharing information and trying to stay up to date on the mandates. And so we could make sure that we were handling the situation as best as possible. I was in it like everybody else.
Thank God. Hopefully, we're seeing the end of most of that.
Yeah, yes.
And everything. What made you pursue additional certification specialties or continuing education as you have matriculated over these last 15 years? I mean, I know we know why you're
Well,
endodontist, but have you pursued any more certifications or
well,
specialties or CE that's
you
significant?
so you have to still maintain even your basics of CE or even a mid-level, because if not, you'll be doing the same thing you learned 15 to 20, 30 years ago, which you can't. You have to evolve and grow as a clinician. So I try to go to my specialty conference and try to maintain not just a basic CE for your licensure, but try to maintain for yourself.
Okay, gotcha. Well, Dr. Small, we definitely almost to the end here of
Mhm.
the questions. And the last one is more towards diversity and representation. What ways can newer alumni help strengthen diversity and inclusion in this profession, in your opinion?
I would say for newer and older alumni, put yourself out there and get a seat at the table. Don't just go to work and go home. Because if you do, no one's going to know who you are, and no one will know that we exist, and no one will know
Right.
that we're here in our profession. So when there's dental society meetings, yes, they're late, they're at 7 o'clock, you want to go home, you're tired, you have to cook dinner, you have kids. I understand that 100%. But like I said earlier, if you're not at the table, you're on the menu. So we may have specialists, board certified, super smart people, but if we just go to work and go home, no one knows who you are. So you have to get on these committees. You have to go to your dental society meeting, get on a committee. When they start talking crazy, raise your hand and say something. Be that face so they know that we're here. In organized dentistry on a state level, city level, and national level. I'm not saying you have to run for ADA president, no, but we have to put ourselves out there for them to know who we are.
I feel, and I can only speak for Howard because that's where all my education was, undergrad and dental school. But on top of all the clinical things that we learned at Howard and that community dentistry department, my time it was Dr. Georgetta Manning Cox, but
Yes.
the stalwart of that department, even today, is Miss Romella Rogers.
Miss
And what
Rogers.
we had to do, God, I love Miss Rogers. What we had to do in those communities, Gage, Eckington, go to those health fairs. A lot of my counterparts, saw that as a waste of time. No, that instilled in me to, when I got out, it was like I had to go to the children's home. I had to go to the prisons. I had to go. I ain't saying everybody should do this, but it instilled in me that, there's more than just money. For me to sleep better at night, this is just Dondre. I ain't saying this to everybody else. When I do good, I can do good in my practice and make a lot of money, which that's fine. We do. But it's the other things that we did in community dentistry, and it's still going on today. Matter of fact, students are going to Knoxville, Tennessee in a couple of weeks. They're going to Jamaica. They're going to Guyana, actually, in March. And these students are paying their way. So that's another thing the Alumni Association and another organization that I'm with is trying to help, because they're getting credits. The faculty is going with them. But I say all that to say is that if it wasn't because of those extracurricular or extraneous activities that we were doing that the school required us to do to graduate, it instilled in me and a lot of others to keep doing that in our communities. And I think that's just totally awesome. And like you said, that puts us at the table, because when a lot of people see that we're not just in our offices, but we're at the churches, we're at the board meetings for the community, we're in our state congressional hearings, giving testimonies about what's going on in our community in that state. Those senators, those lawyers, those pastors, those community leaders are seeing us. And when that happens, it's more than just helping the underserved and doing teeth. So I've been always so proud of you, Dr. Small. Chanelle.
Thank you.
With Dr.
Thank
Small.
you.
It's just so awesome. Do you have any parting words or anything that you would like to say to other alumni that might be looking at this? Students are definitely going to be looking at this also. This is your time to just kind of, sum this thing up for you.
We've said it all. I think you did a great job at asking the pointed questions. We've said it all. It was a pleasure. I'm so thankful for the opportunity. Thank you for thinking of me. And I welcome all things Howard, HU through and through.